history of the medical sciences at Oxford is closely entwined with the history of the university itself. Over the centuries, the institution has educated researchers and clinicians who have made revolutionary contributions to healthcare and has been the home of outstanding research and teaching. As Vice-Chancellor of the University of Oxford and a medical researcher myself, I am proud of the role that Oxford has played in delivering world-class research, engagement and training that advances primary care, influences health policy and develops professional skills for the delivery of better healthcare in the community. Artificial intelligence is expected to have a significant impact on healthcare in the future, with the potential to improve patient outcomes, reduce costs and transform the industry. A physical hub for the Institute of Digital Health is vital for bringing together the broad range of Oxford's expertise in one location and for fostering cross-disciplinary collaboration, innovation and responsiveness to global demands that makes the University of Oxford world-leading.
The Radcliffe Infirmary opened in 1770. The building was paid through the estate of Dr. John Radcliffe, and the running costs were covered through the generosity of voluntary donations by local people. It was originally a 5-acre site in St Giles's open fields, which were considered far from the city at the time. In the course of its over 250-year history, it's been the site of a series of clinical firsts. The first intravenous dose of penicillin was given to a patient at the Radcliffe Infirmary, and the first accident service was introduced here, amongst other initiatives. It has also been the training ground for thousands of doctors, researchers, nurses and other primary care providers who have contributed to the welfare of people in countries all over the world.
Hello, I'm Professor Richard Hobbs, Director of the Oxford Institute of Digital Health and former Head of Department of Primary Care Health Sciences.
The Nuffield Department of Primary Care Health Sciences is the world's largest and most successful academic department of primary health care. But even as we in Oxford celebrate the past, we're always looking towards the future. That's why the department recently established the Oxford Institute of Digital Health. Our aim is to tap into Oxford's global reach to address critical challenges and harness digital innovations that will transform the future of healthcare. The Institute's home will be in 2 buildings on the historic Radcliffe Infirmary Quarter. Currently, both are at the end of their useful life, but the department felt strongly that it wanted to restore, not demolish and rebuild. In other words, to embody the university's net zero carbon, high energy efficient goals at actually less cost than new build. The Institute will bring together researchers from different disciplines to drive forward digital solutions to healthcare and identify opportunities for new research and innovative applications that can be accessed by patients and primary care professionals alike. The project will include teaching spaces so that we can expand our newly established programs that provide training for the healthcare leaders of the future. The renovation will unite the 2 buildings with a central covered atrium promoting interaction of students and academics, all within the heart of the University of Oxford's Radcliffe Observatory Quarter.